Hi, everyone. Thanks for joining. I'm Michelle Blackmer. I'm the Chief Marketing Officer at Rhapsody, and delighted to talk with you today about interoperability and AI readiness, which obviously are two really hot topics that have quite a bit of energy around them. There's growing excitement, and with that, I think a bit of a gap between excitement and execution. I'm at a HIMSS event today in Arizona, and this has been a topic here, and so I know it's a lively and energetic conversation, and hopefully that comes through in our webinar today. Some of the use cases for AI are showing real promise, and also revealing how our healthcare workflows and healthcare data continue to be fragmented. Prior authorization is one of the examples of that tension. It's operationally painful, highly manual, and full of friction, which does make it a compelling opportunity for AI. And it also exposes something deeper, which is that AI requires an underlying strong data foundation layer. So today we're going to explore both sides of that equation, what the market is showing us through Elion's research, and what healthcare organizations are doing to prepare and what they have in place, with which Rhapsody is expert in talking about. So I have two subject matter experts with me today, Colin Durant from Elion and Drew Ivan with Rhapsody. And I'll let each of them introduce themselves first, and then we'll dive into the conversation. Colin?
Great, thanks, Michelle. So I'm Colin Durant, Director of Research at Elion. If you're unfamiliar with Elion, we help provide organizations discover and evaluate healthcare technology. We maintain the industry's most comprehensive mapping of the health tech landscape. Over 2,000 products, over nearly 200 categories. We publish weekly research that more than 7,000 healthcare leaders follow. My background really bridges kind of data science, product management, market intelligence, and I just want to tell you, when Rhapsody reached out, I jumped at the opportunity to join this conversation because, I've had tons of conversations with vendors and health systems over the last year, and, I think you sort of hit it exactly in your intro, that everyone is very, very excited about the promise and possibility of AI, but the execution and on-the-ground reality is, I think, a mixed experience across organizations. And when Rhapsody published your digital maturity framework, it really kind of resonated with the types of things you've been hearing. So really excited for the conversation today.
Excellent, thanks. And Drew?
Can you hear me okay? I'm having a little audio trouble.
I can. I know for the audience, we were talking before this about how technology is maybe not our friend today. So we're hoping it holds out. And Drew, it sounds good right now.
Okay, great. Could you repeat the question?
Just introduce yourself.
Thanks. Hi, I'm Drew Ivan, the Chief Architect at Rhapsody, and I focus a lot on working with our customers on their interoperability challenges and how to track where they are today and where they need to go in the future.
Perfect. And I think everyone's made their way here today, but you might have joined because you heard about this through Elion or you heard about the webinar from Rhapsody. So I don't want to assume that you know who Rhapsody is. We are working with healthcare organizations around the world, helping them connect and share data, and really partnering with them as they move forward on digital innovation. So that includes many of the folks on the phone. Thank you for being customers. And if you're considering becoming a Rhapsody customer, we look forward to working with you. We're going to talk today, Colin mentioned the digital maturity assessment and model that Rhapsody introduced earlier this year. So I have this up on the screen, and we'll refer to this at times as we move through the presentation. And then also in the chat, we will share a link for you to take the assessment yourself and sort of see how ready are you for AI and what are some really pragmatic steps that you can take to become more prepared. One of the things that Rhapsody prides ourselves on is being extremely pragmatic. And so we were careful in this model and in the assessment to bring that paramount forward in our focus, to make it something that you could quickly take and then quickly action. And from a housework perspective, the Q&A panel is open, and if you send a question as we move through the webinar, I will field it and ask Drew and Colin in real time to expand on the topic. So we'll certainly field questions at the end, but don't hesitate or don't feel like you have to wait until the end. We are very adept at taking them in real time. All right, so let's dive in. Like, Colin, where are you seeing that AI is delivering real operational value in healthcare today? And where is it maybe still ahead of reality?
Yeah, absolutely. You know, I mean, I think the sort of clear success story is obviously going to be on the ambient documentation side, right? So, you know, listening technology and sort of being able to translate that into kind of real-time notes is like, I mean, I think, you know, just several years ago, that still felt very novel and new, and now has become table stakes. And I think we look at these scribing companies and they're sort of starting to move into other areas as, you know, I don't want to say commoditized, I feel like it feels like a strong word, but like that core technology of like, hey, we can listen and turn that transcript into sort of something usable in the documentation side, you know, that's kind of the biggest piece. You know, another area where we've had a lot of focus at Elion over the last year is within revenue cycle, right? So revenue cycle automation, you know, it's a very kind of linear, somewhat manual process with a lot of kind of discrete steps, which involve kind of moving data around. You know, that's been an area where, you know, I would say in pockets, we've seen a lot of real AI success. You know, I think on the generative AI side, like a very kind of clear example is, you know, within denials, right? The payer is often asking you to put together this clinical justification letter. Like reading a lot of evidence and assembling that into a clear response letter is, you know, something that AI is really, really good at. You know, I think where it's still, you know, where some of the hype is still operating ahead of reality is, you know, I would say like fully autonomous type of like agents operating across multi-step complex workflows, right? You know, we had a piece that we did last fall, and I think there's still sometimes a little bit of like misinformation is maybe a strong word, but like a little bit of confusion around like where is the line between like, you know, really like automation and agentic autonomous sort of action. There are a lot of areas where, you know, I think it's maybe being marketed as like sort of AI or agentic, and it's, you know, it's really just maybe complex multi-step automation, which is still helpful, but is not quite at the maybe sort of like the agents making decisions piece yet.
Yeah, that's a topic near and dear to Drew. We've discussed a lot over the last 6 months, like what truly is an agent. And sometimes I think agents, like you can't dismiss what's not an agent, because to your point, it's still really, really helpful to have automation.
Absolutely. You know, I would say if I look across, if there's like a core pattern, right, and you know, I think it's you know, kind of very foundational to what we're going to talk about today. I mean, in the areas where there are bottlenecks, I would put it really into kind of two camps. One is, I would almost say it's like human operational bottlenecks, right, where basically where the people processes are very fragmented, and there's like maybe even internally not good kind of documentation or good operational practices. And then two, I would say kind of that sort of data foundation, that kind of unified layer, that ability to kind of really speak to systems. And sometimes that first operational problem is because of the second, right? People are operating in a fragmented way without AI, you know, because they don't have that sort of foundational layer, right? And so you know, as we were prepping for this webinar, you know, I feel like the realization I've had talking to a lot of systems is like, agents are some AI companies are very eager to throw AI and automation at the problem, but you can't automate your way out of like a bad foundation structure. You know, you're basically just trying to like double down on something that's already not working. And so I think, you know, for folks who've maybe been disappointed with AI implementations, it's usually not the AI models themselves or the technology, it's sometimes that readiness piece.
Yeah, that lines up with our with what we're seeing in the market as well. Drew, anything you want to add to that piece, or that you're seeing as you're traveling about talking with customers around their AI readiness?
Yeah, I think I would agree completely. What we're seeing is a lot of customers who are starting to identify the problems with their data approach. Like everyone knows there's good standards for putting together a data strategy, making sure the data is clean and making sure it's well organized. And it's considered good hygiene and a good practice. But in the past, it's been okay to cut some corners there, or not do a completely robust job of organizing your data because it was good enough for the use cases that were being implemented. Perfect example is in EHRs, you get a lot of extra data in the patient encounter notes because there's copying and pasting, there's templates with a lot of defaults. And so a lot of the information that's in there is, superfluous perhaps. So that's just one example of how bad data can creep in. And it's been okay for the use cases of providing patient care and doing billing and some analytics. But now that AI is coming into play, all of those bad data habits that have been stacking up for years are really turning into big problems because AI relies on clean data. And the data that was clean enough for yesterday's use cases is perhaps not clean enough for the more intense, robust use cases that AI is bringing to the equation. And so we're starting to see customers needing to refactor and readdress some of that foundational data organization that they've been getting by with for years.
Someone was telling me last night that they, like you're saying, are having to fix a data foundation that they haven't fixed for years, but without adding additional resources. And so really forcing a prioritization, which I imagine many people in the audience are experiencing as well. Colin, you mentioned prior authorization as one scenario, and I know you recently published research on that. Why is that? Why do you think that's such an important use case to examine right now?
Yeah, apologies to maybe the international audience, where hopefully if they live in countries where prior authorization is not as prevalent as it's become in the United States, right? But just to kind of define prior auth real quick, just make sure everybody's kind of level set, right? It's hey, we want to deliver certain care. It requires pre-approval from the payer. Therefore we have to they have a set of kind of requirements or guidelines that they're going to sort of make you submit to decide, and then you kind of maybe have hopefully you just get, okay, great. A lot of times it's a lot more back and forth. But, one of the reasons, when we were, prepping for this discussion, one of the reasons that kind of I felt like really resonated with a lot of the themes we're talking about is, first of all, from a scale challenge, right? It's a big problem for health systems, right? Your practice, the average practice has 39 prior authorization requests per week, up to 13 hours of staff time. There's 1.26 billion in administrative spend in 2024 just on prior authorization. And it's also an area where regulation is really kind of forcing some modernization. CMS regulation 0057 or 0057F, which went into effect this year, is really kind of changed some of the payer requirements on the data they're allowed to submit back. And then I would say we've kind of hit a point where we were kind of earlier talking like, hey, there's a lot of individual steps that are kind of working. But the technology really is maturing into a place where it's no longer can AI help, but what has to be true in this environment for AI to work at scale to help solve kind of the scale of that problem. And then I would say almost like more foundationally is just if you think about a case where it's like, hey, it's a lot of data collection across a lot of entities, sometimes within the system, sometimes outside of the system, sharing with another entity with whom they've not always wanted to make data exchange very easy, right? I'm sure everyone's heard the experience of like, oh yeah, in order to get like a status update on my PA, I have to call and sit on hold for 2 hours with some payer phone line, right? And so I think it kind of exemplifies.
And even when you get it every year, that same authorization every year, you're still going through this. As a patient, you're having that experience year over year. I see.
Yeah, absolutely. So I feel like it's a big problem. It's a problem that on paper, I think with technology should be addressed kind of more fully. And I think the moment feels kind of very ripe, which is why I was like, hey, this is one where it's like, hey, every health system in the US, at least I think is probably like, hey, this is a big problem for us. And so how do we make sure as these new prior authorization solutions come to the market, because there's a lot of money, there's a lot of investment in research and innovation being flooded in, like, how do we make sure we're ready to take full advantage of that?
Where I mean, and obviously it's breaking down with the data foundation, or where do you see it really breaking down today?
Yeah, I mean, so one is going to feel like a very basic kind of interop piece, but it's really just the do I need a prior authorization at all, right? So prior auth is still very much on the EDI rails, and like a 270, 271 is not going to reliably give the amount of information sort of required. There are DaVinci cover or CRD APIs that exist now. I think not. That's I think the hope of 57F, and the payer is going to be much more robust in that information. But that requires on the provider side, like, hey, you have your ducks in a row and be able to ingest that information, and then do the next step, which is where I would say things maybe kind of break down and are still very manual in a lot of organizations, is that evidence assembly, right? So first of all, it's just like finding out, do we require a prior auth? What in for that prior authorization, what information is needed? And then when now I'm the the human on the other end of the provider system, maybe I have that response. Do I have access to the information I need? Am I able to kind of do that in a sort of seamless way? And then I think kind of then the third piece is really kind of what we just touched on, which is kind of that that sort of channel fragmentation and status tracking of like, okay, like once I've submitted it, how am I submitting it? Is it still taxed in a lot of cases? Unfortunately, yes. How am I getting status updates to that phone, right? And so, if something we had kind of talked about previously is the regulatory part is forcing the hand of the payers a little bit to say like, okay, we have to modernize. I think now on the sort of provider side of the world, it's got to be like, okay, we're going to hold them to that promise because we are also ready from a technology standpoint to take full advantage of the modernized APIs that the payers are supposed to be providing and integrating against.
It's like a forcing function. I like it because it's a really tangible example that's relevant to all different parts of the healthcare ecosystem, payers, providers, and healthcare technology companies. Maybe less so outside of the U.S. So certainly fair to think about other use cases like you mentioned, where that interoperability or data sharing is really paramount. Maybe Drew, what Colin's saying here is it's not just a workflow problem, but also a data and interoperability problem. And I was curious if you could talk more about why you think that is, and maybe customer examples, whether they're prior authorization or nearby, that sort of highlight why have a strong foundation, or what happens when you do have one or don't have one.
Yeah, I think if you sat down to solve the prior auth problem on a whiteboard, or any problem of a similar nature, it would be pretty straightforward to build a solution. Because if you think about it on paper, really what you need is the prior authorization rules from the payer. You don't even need AI. It just needs the rules encoded in a machine readable format. You need the provider being able to ask questions about those rules, and then submit a patient case and say, we think this qualifies for your rules, we're requesting prior authorization, and then get back a yes or no from the payer. So it feels like a very clean workflow with just a few elements that need to be nailed down. So it seems like it ought to be an easy problem to solve. But the problem is, as with many use cases in healthcare, you're not talking about one payer and one provider. You're talking about hundreds of payers and thousands of providers. And each of the payers has slightly different rules. Each of the organizations on either side of the equation has different capabilities. They're at different stages in this maturity model that we're looking at. Some of the payers, only publish their rules on paper. Some of them do have electronic capabilities. There's standards that cover some parts of the equation, not others. And so you end up with this very incomplete solution. And the problem with that, the problem with the partial solution is that it's even worse than no solution, because now you don't know if any two endpoints can ever connect without quite a lot of effort in between. And so you do have this scenario where CMS or a government convener can can provide some clarity by saying, you know, here's the rules of the road, here's what you must do, here's the least common denominator, here's the core data set that you have to exchange, and that can at least get things started. And so I think that's kind of where we are with prior authorization, but we're at different places with each of these use cases that we might want to enable with AI.
Well, and that ending on AI there makes me curious. Oh, your video went off and on. Makes me curious. What are you seeing? What has to be true in an environment? I mean, you're seeing this at Rhapsody, and also as you travel about, like, what has to be true in an environment before AI can really work reliably and at scale? Knowing what you know today, obviously, it's changing.
Yeah, we're very much in the early days of AI, and it's deceptive because AI can do really amazing things. And so it gives the impression that it's really quite mature and ready to be used for everything. Under the hood, there's quite a lot of work to do in order to enable those use cases. So I think what needs to be true is a number of things. One thing that we already talked about is you need clean, rationalized, actionable data in a place where the AI can access it and reason on it. You need the right combination of AI products. And I think there's another piece of the equation, which is you need the right people, because we're not yet at a place where the AI capabilities are embodied in a simple tool that's easy to use by anybody. You do need AI experts at this point to be able to put the pieces together in a way that accomplishes your goals. And if you don't have all three of those things, you will run into a roadblock at some point in the project that you're trying to enable.
Yeah, and
that's an interesting one. We could probably have a whole webinar on that. Go ahead, Colin.
You know, I would double down on the people side, and you know, it's something we hear from both vendors and health systems a lot, which is, I mean, I think sometimes IT within a health system becomes a little bit of a punching bag. But I think if we step back and feel empathetic, it's like the scope of their role has changed so significantly. You know, I think a lot of IT departments very much focus on more of like a service IT model, like, hey, we have got tickets, we've got a broken iPad. Like, you know, these organizations are not set up for like, hey, we've got 100 new AI applications that people want us to review every month and think about the integrations. And or, you know, we even have like maybe a dozen in production and we're not getting the sort of results on them. And, you know, I think the vendors are, you know, they're never going to be like, oh, hey, the problem's us. They're like, oh, yeah, we don't have the right IT support, or, you know, let us forward deploy your organization. And, you know, I think, you know, figuring out that strategy from an organizational side of like, do we have the right people to sort of help mediate these conversations and help us put together that stack and strategy? You know, at Elion, that's, you know, where we think about that is like, do they have the right information to do that, right? But I think, you know, to Drew's point, I think for an organization to be ready, you know, they either need to hire the right people or think about, you know, providing opportunities for the people within the organization to take the time to learn, because, you know, it is all moving very quickly, and, you know, knowledge becomes stale very quick. You know, just real quick on prior auth, like, you know, one thing you know, what struck me as an irony is like, you know, a real area of innovation within prior auth is the voice AI piece we touched on. It's like they can make the phone calls and sit on hold, but, you know, that says a lot about the state of kind of data integration when like the innovative thing is teaching an AI to sit on hold on a phone call. And, you know, I think it really is illustrative of like where there's still so much opportunity to make this process much, much better.
Definitely. Well, as you mentioned, prior auth, there is a question from the audience. If you are seeing payers ready to comply and really offering robust prior authorization APIs, and if so, where? I don't know, Colin, if you are seeing that or no?
Yeah, I mean, we're hearing sort of anecdotal things, right? I would say. You know, I think there are a few regional payers that seem to be more invested in kind of making this happen. You know, when you have a state where maybe there's one major commercial insurer and like, you know, one large sort of provider organization, you know, I mean, I think Drew's earlier point on the sort of, it's not just one payer, it's thousands of payers and single payers. And so, you know, when you have the rare cases where it's a market where it's like one dominant commercial insurer, one dominant provider system in that area, you know, I think that type of consolidation has maybe downsides in a lot of ways, but like in collaboration, it has some real advantages, right? And so, you know, I think what we'll probably see happen from like an adoption standpoint and from some payers is we're going to see pockets of people who are showing it can work within a microcosm, right? I think a little bit about like the announced pilot that a bridge is doing with Highmark, where they're trying to integrate ambient AI directly into the prioritization process. You know, that kind of works because Highmark is a provider. You know, they're on the provider and the payer side, so they can, it all kind of lives within one ecosystem. But I think those types of examples of like, you know, early adopter, not the right word, but like it's a closed enough ecosystem that like they could say, okay, this can work in this sort of small example. Now, how do we think about scaling it across a lot of different organizations?
Yeah, which I suppose kind of comes back to the people, and it's always a marriage of technology and people, but you know, how you think about the right people. I was glad that you said either hiring them or training them, because I think identifying people in the organization that have experience, but also curiosity and like a bit of agility, and I don't think there's sort of like a single formula of what will work with AI. People was something that was just coming to mind for me when you were talking about the people earlier, which I want to use as a segue, Drew, to talk a little bit about the digital infrastructure maturity model. And I have it up here on the screen. I was hoping that you could kind of give your perspective for people who might be seeing it for the first time, or likely saw it before and thought it was interesting, and that's why they registered for the webinar. So I'll ask you to do that, and then Colin, curious to hear yours as well.
Yeah. I mean, I like this model. We've been doing interoperability for a long time, and we've never really written down the maturity model before. The reason I like maturity models is because, first of all, it challenges organizations to figure out where they are on the model and figure out where they want to be. There's maybe an implicit assumption built into a maturity model that you always want to be at the top, and that might not be appropriate for every organization. Maybe some organizations don't need to go beyond level 2 or 3, but it's good to know that there's a level 4 out there. So I like that that it gives a framework for being able to talk about where you are and how to get to the next step until you get to the step where you want to end up. Because without that framework, it can be very undirected. Like how do you know how to get from step 1 to step 2? It can be very difficult to factor that into budgeting and project plans and so forth. But just knowing what it takes to get to step 2 lets you organize those things, prioritize them, and put it in a 3-quarter plan or a 2-year plan, whatever it takes to get there. We've broken it down into 4 steps, which I think is a good number of steps. If it was less than that, the steps would be too big. If it was more than that, you'd have a lot of debates about, am I in step 6 or 7? So I like the 4 steps. I like that it starts with the very basics of connecting. Like, can you get data from point A to point B? Because that really is the bare minimum. And actually, I mean, that's what we have with fax and phone. When you say you're sitting on hold with a payer for 2 hours to get a status update, that's a rudimentary connection. It's just not really a data style of connection. And so you can see just from that analogy that connecting is really not enough. If anyone thinks that they're okay just staying at level 1 of the maturity model, they probably need to look a little deeper, because where you really want to get to is at least the standardized level, where you're using agreed upon standards for the format of the data, but more importantly for the content of the data. Since we're talking about payers, it's one of the things we've standardized on is ICD-10 codes for reporting diagnoses from the provider to the payer. If you're trying to, if a provider wants to get paid, they have to encode the diagnosis as an ICD-10 code. And by the way, it took years to go from ICD-9 to ICD-10 because that was a big change that took providers a long time to accomplish because of what we talked about before. There's all sorts of capabilities within the huge provider community. So standardize, I think, is really the place where we have to get to be functional for most use cases. After that, optimize is really about instead of treating each connection as a new project that doesn't inherit anything from the previous projects, start to build a long-term strategy where you can reuse connections, reuse concepts, aggregate data, and start to take advantage of some critical mass that you're building by becoming more connected. And then that lets you get to innovate, which as we've said in the slide here, that's where you can start to leverage AI and take advantage of the data and interoperability assets that you've built in the earlier stages.
Colin, how do you think about it? I know you have spent some good time thinking about it as well. And how do you think how can buyers really think about it from your perspective?
Yeah, absolutely. So we do buyer's guides across a number of categories. We kind of talked about the prior auth one a little bit today, but a part of every buyer's guide is an evaluation framework, and that's really evaluating how that solution fits into my particular organizational needs. Something I like about this maturity model is it's kind of like the pre-work you do as an organization before deciding how what those needs are, right? I think a lot of times what we observe is sometimes organizations are like very acutely aware of their pain points and how they want those solved by technology, but they're not always ready to fully, I would say, like analyze what solution might be a best fit because they don't necessarily even have like the internal inventory of like, okay, if I acquire the solution that has a lot of shiny bells and whistles that like I think will be helpful, like is it going to work in my environment, right? And so something I really like about the framework is like I think every organization should be doing this type of level setting, just like going into any sort of technology discussion. I think for IT teams, like we talked about earlier, it gives them a bit of a language that they can use to discuss with their operational stakeholders, right? I think everyone is like, oh, I don't want to always hear no from IT all the time, right? And maybe you still have to say no, but if you can say, hey, here's how we view where we are on a maturity scale, we would love to be able to support X, Y, or Z use case for you, but like, we're still at like, the standardized phase, right? We're not quite at the maturity level where we think those types of solutions can fit right in. One quick note on standardize, and I think it's something where I think people maybe kind of like not overestimate, but maybe like underappreciate the value of standardization is. I think with LLMs now, there's an assumption that like, hey, like we don't actually have to standardize on a common sort of set of definitions, like the model can figure it out. But like within a context window, you're not necessarily going to have, you don't want to have to be encoding like 1,000 transformations of like, oh, hey, when it's coming from this service line, it means this. When it's coming from this service line, it means this. Can the model handle that? Probably. Are you going to get the best performance out of your solutions? Almost definitely not, right? And so, I think a little bit about, when I started in healthcare data a little over a decade ago, it was kind of like, FHIR was the great promise of interoperability. It's like, we're gonna be able to move things around, but something I always try to remind people of is like, okay, like it at least makes the data standard and format more interoperable, but like it doesn't change how different organizations are going to use it. And to Drew's earlier point around like hey, there's maybe a lot of cruft because like things kind of get repeated or templates or that kind of thing. There's still a lot of human translation and a lot of individual organization idiosyncrasies that like exist, and people are good at managing around those because they're like, oh, hey, I've been in the organization, I have a good sense of what this means. And an AI solution can learn how to handle those over time, but you're choosing to continue to carry some form of like data debt or tech debt. It basically puts an artificial sort of ceiling on, I think, on some of the potential you can get. And so I think that I think a lot of people want to jump from the connect to the optimize and innovate step within this framework when standardize, even though it feels very boring and like kind of rote, it's like nobody wants to be doing like data mappings all day. It's still so very foundational to I would say making the most of this technology.
Drew, any thoughts on that? Otherwise?
Yeah, completely agree. You can definitely make the world's most expensive translation table with an LLM model. It's not the right tool for the job. It's a useful tool for many jobs, but just because it can do all these things doesn't mean it's the right approach. And sometimes the more straightforward approach is more performant, more reliable, and it can still be assisted by AI, but it shouldn't just be as simple as throw it all into an LLM and let the AI figure it out.
Don't turn over your discernment and critical thinking all at once. There is a question from the audience, and I'm conscious that we're getting close to end of time. So they're actually asking what AI tools Rhapsody is planning to develop for integration engineers who use Rhapsody to develop interfaces. And so must be a customer asking that question and teeing us up, Drew, to talk a little bit about Axon.
Yes, exactly that. So Rhapsody's name for our AI products is Axon. And right now we have the Axon chatbot built into current releases of the Rhapsody and CorePoint integration engines. And it runs in a window on the side of your IDE and can help with all the questions you have about how to build interfaces. Where we're taking it in the future is to exciting places where it can actually help you build those connections and automate a lot of the work that our users are doing. And so the reason that we're taking this approach is because Rhapsody and CorePoint have always been tools for leveraging the expertise of integration experts. And so there's a lot of features built into those tools to make them more productive. And we see this as the next evolution. By putting an LLM-based tool into the product, we're able to make it so that the integration specialists can focus on the integration analysis and creation, and leave a lot of the building and a lot of the details to the tool that's good at that, which is the AI. And so we're excited about that. Like I said, it's in the current release of both the Rhapsody and CorePoint products, and it's getting smarter over time because we're adding capabilities to the LLM that immediately become available to anyone who's using it.
And watch your emails because and also ask your IT teams not to send the marketing emails to spam from Rhapsody because we are sending more information about Axon to you all the time and new ways to access it and learn. So I want you not to miss that. Thank you, Drew. We did have another question from the audience, which I don't want to put us on the spot, but it triggered a thought for me. The person was asking about the Carnegie Mellon capability maturity model. And one of the points was that model is very focused on the explicitness of moving from adding something or moving between stages. And that resonated to something that was coming across from you when you were speaking, Colin and Drew, about the model. Like the model, like any model, gives you some guardrails or context. And so, like you said, if someone brought you a project and you're not ready for it because you're in the standardized phase, it does let people sort of have a goal or a defined way to get their project, bring it into scope, or what has to happen maybe before they could bring their project into scope. And so I like that deliberateness was something that the person was asking about and also came through for me when you were speaking. Okay, I'm going to ask one final question of each of you, which is for those healthcare technology leaders who are on the phone today, what do you suggest that they do within the next 12 months to make real progress with AI? Drew, do you want to go first, or Colin? Yeah, whichever.
Sure.
Let's let Colin go first.
Yeah.
Okay, great.
Yeah. Well, I mean, I think it goes a little bit back to these sort of like this sort of upskilling and the learning piece, right? It's like, I mean, I think, you know, sometimes you get maybe folks at the CIO level or at the C-suite level, they're like, oh, I shouldn't be using these tools. Like, you know, one is, I mean, I think more people should just be playing around, right? Whether that's getting something like Claude Cowork going or, you know, other tools. You know, it feels weird to say, hey, it's organizational advice to like experiment with AI in your own work. But, you know, I think one of the points that's kind of come up a lot is like where maybe models work well, where they don't. It's like, it's very hard to develop an intuition around that unless you've like actually kind of tried to use tools, right? And so, you know, I think as you're sort of thinking about your organization running this, you know, don't rely on, you know, just kind of like, you know, white papers or, you know, sort of things you hear secondhand, like play with the tools a little bit yourself. You know, I think the other thing that I would always kind of keep in mind when we look at a framework like this is like, one, you know, it's not necessarily like the whole org is going to be on the same step at all times, right? There may be some areas within the sort of enterprise that you're like, okay, we're a little bit more mature in that area. That's where we can kind of experiment, right? And so, you know, I think it is hard because I think everyone has a sense of like, hey, it's moving so fast, am I being left behind? Are we behind, right? I get that question a lot when I'm talking to sort of provider leaders. And, you know, the good news is like, I think kind of everybody's behind in the sense that, you know, the technology is moving very quickly. But, you know, I think it's important to sort of contextualize a maturity model like this is like, it's not saying don't adopt early. I think it's saying be very clear-eyed about where you are in that adoption and where maybe there's going to be challenges, right? And so, you know, I think you could be very sort of, you know, have a deep understanding of where you sit from a maturity standpoint and still be an early adopter and not feel like you're way behind. It's just, you know, I think, you know, it takes a lot of operational discipline. It takes a lot of partnership. And I think, you know, I think those are probably the big pieces of what I would say.
Yeah, completely agree. AI is an unusual technology in that it improves itself, which means that it doesn't improve at the rate that humans can put more work into it. It accelerates because the work that the humans put in turns into work that the AI can put into the next generation of AI. And so, yeah, everyone's behind. It's changing daily. It probably has changed during the course of this webinar, right? If you hit refresh on your browser after this webinar, you'll see that something new is out. It's going to be harder and harder to keep up. Yeah. So we're in a period where it's moving fast and not equally across the board. So I would say the sooner you can get started, the more you can take advantage of the acceleration. I think what Colin said is right. You have to experiment with the AI so that you know what it does well in your organization or in your circumstances and where it falls down. And where it falls down, you have to decide, like, is it ever going to be good at this? Is there something I can do to make the AI better at this? Do I need to change my data model? Do I need to change my underlying capabilities so that AI can be brought to bear on this piece of the puzzle? And that's what you have to find out. And there's no real roadmap for this. It's never happened before. But, you know, we have adopted new technologies before. We know that there's a lot of change control. There's a lot of education and training that's going to go into the workforce. It's a big effort, and it's an exciting time to be in the field.
Those are great answers. We could talk more about that more. I got a lot of activity in the Q&A. Someone was reminding that Opus 4.7 is now available and asking if Rhapsody got access to meet those. And we did not, but we did discuss internally that maybe we should, you know, ask if they know who we are and request access. And then also, can third-party messaging apps access the AI? I think that question's about Axon specifically, Drew.
Mm-hmm. Yes, Axon is a web-based user interface in front of an artificial intelligence that knows quite a lot about healthcare interoperability. We'll be releasing a web version so that you can go in independent of the Rhapsody and CorePoint IDE. The web version will will have some limitations. Specifically, the version that's built into the IDE will be able to control the IDE and assist the user with doing tasks, which won't be true in the web version. So if you have a third-party messaging solution other than Rhapsody or CorePoint, you'll be able to take advantage of Axon's information, but it won't be able to connect with that third-party tool and make changes to a configuration.
Awesome, thank you. Okay, well, that brings us to the end of time. Really appreciate so many of you staying on for the whole conversation. One more question about Axon. Can Axon directly inspect and analyze message payloads, such as HL7 or FHIR, for troubleshooting and interface monitoring? Or is it primarily an interaction through at API level abstractions? And in either case, how is PHI secured?
Yeah, that's the big question. So the answer is whatever you put into the Axon tool is something that it can operate on. We suggest not putting PHI into the Axon tool. In fact, we ask users to agree not to do that. Test data is fine. Message structures is something that it can look at all the time. We are building up our defenses to prevent Axon from seeing PHI. But the very best defense is for the user never to put PHI into, not just Axon, into any tool that's not meant for that type of activity.
Awesome, but it can inspect and analyze payloads for troubleshooting, right? I guess not PHI, but other payloads.
Yeah, what we would recommend is to do that in a test environment with test data.
Okay, perfect. Thank you. And let's see, for everybody who would like to know more about Axon or the digital maturity assessment, we will email both to you in follow-up from the webinar. Also, the team placed a link in the chat that you can take the 2-minute assessment right now if you want before you hang up. You probably have 10 minutes before your next meeting, so take 2 for that and then 8 to do something for yourself, like get water. And otherwise, thank you so much. There were a couple more questions about Axon. We'll follow up with you directly, and your account manager can also help you. Thanks so much, Colin and Drew, and everyone for attending and preparing for today. And we will talk soon. Take care.
Thank you.
Thank you.
Take care.
Thank you.
Thank you.